Hey guys, welcome back to the channel. I'm Dr. Dawson and this is my rabbit Crumpet. Now Crumpet was named this way. It's a little bit of a funny name, but he was named Crumpet because he is a grumpy old man. He's probably only about 2, but he acts like the grumpiest of grumpy old men. And so I just thought I'd share that little story. Today we're going to be talking about veterinary care in rabbits. There are about 6.5 million rabbits in the US as of 2010, so it's a little bit outdated, but I can't imagine that there are fewer than that. And many of those rabbits go their whole lives without any veterinary care or intervention. So a lot of rabbits die at a younger age than they probably should because there is no veterinary care, and there's a lot of rabbits that don't get the correct preventative care that many other species get to enjoy, such as dogs and cats. Dogs and cats get a lot of preventative care. They get vaccines, they get their dental health taken care of, they get good nutrition and good nutrition discussions, they get good sterilization surgeries, they get a lot of preventative care that rabbits and other small mammals maybe don't. And a good example of this was actually today. So dogs and cats often we recommend being on a flea and tick prevention, and that's being promoted in a lot of those areas. Now in rabbits, they don't often get recommended to have flea and tick prevention. And today we actually had a guinea pig come in, and this guinea pig had a bunch of lice. And if you're lucky, maybe you'll get to see a picture of one here that we saw on the microscope. And all you have to do is use proper flea and tick prevention, and these lice will be killed, and it's not a big deal. But these owners had no idea that that was even an option. So with rabbits, what we really want to focus on here is what to expect, what your veterinarian should provide for you if you go in for a well check, if you go in for a sick rabbit, and if you go in for a rabbit surgery. So number one is, what should you expect from a healthy vet visit for your bunnies? Well, the number one thing your vet should do is a physical exam. And this physical exam will consist of them looking at your rabbit from head to toe, or from teeth to tail, if you want to go that way. And this includes dental health, which is probably one of the most important things that we can look at. This includes listening to their heart and lungs. This includes looking at their skin and seeing, is their skin and is their coat in a healthy condition. This also would include looking and listening to their gut sounds. And lastly, looking around their vent or around their rectum and their genitalia to see, is all of that tissue healthy? Is there any evidence for stones or crystals? And just looking at their general condition. Are they good body condition? Are they obese? Are they too thin? All of these things will be present in a physical exam, and hopefully I'll make a video soon about all of the things I include in my rabbit's physical exams. This should also include a discussion of your rabbit spay and or neuter. And you might say, well, I don't want my rabbit spayed or neutered. Well, it at least should be discussed. And there's a lot of health reasons for getting your rabbit spayed, and there's a lot of behavioral reasons that you will probably want your rabbit to be neutered if they're going to be in the house and if they're going to be well taken care of and interacted with often. This should also include a discussion of your rabbit's husbandry and diet. And the reason that I say this is that probably 80% of your rabbit's health conditions can be resolved through husbandry and diet. And so they should be asking things like, what type of litter does your rabbit have? What kind of hay is your rabbit eating? What kind of pellets is your rabbit eating? How much hay versus pellets versus fresh fruits and vegetables are your rabbits eating? And this is a super important set of questions because fixing a lot of these problems early can prevent a lot of health conditions later in your rabbit's life. It should also include, if my rabbit is having some sort of emergency, who can I call to talk to, and what should I maybe have in my first aid kit? And if you want my recommendations, you can see those in a card up here. So what should you plan on bringing to your rabbit's vet visit? Well, for healthy or wellness exam, as we call it in our clinic, so for a healthy rabbit that has no current issues, well, you should really bring your questions. So if you have any questions about your bunny's health, your bunny's husbandry, any of these things, you should bring those questions. That's probably the number one thing that you should bring to your wellness visit. The second is you should bring your rabbit's diet. So you should at least bring some hay, some pellets, and some treats. And the reason for this is a couple. One, your rabbit really should not go any extended period of time without being able to eat. And the other thing is then your vet can actually get an idea of what your rabbit is eating. Is it a high quality hay, or is this a really poor quality hay? Is this a good quality pellet, or maybe we should look at something else? You should also bring a list of any health conditions or concerns that you have for your bunny. So does your bunny have chronic teeth issues that you've been dealing with, or that you had another vet that was dealing with? All of these things are really important. Or has your rabbit had chronic GI issues? And if so, maybe what can we do to help them along, and what can we do to plan for an emergency? So what if your rabbit is sick, not feeling well? What should you bring? Number one, and this is the thing that a lot of my clients don't get the memo on and don't think about, is make sure that your rabbit has hay with them at the time of a visit, especially if they're sick. This would include hay, this would include pellets, and some fresh vegetables. You know what their favorite things are, bring them. Because if your rabbit's not eating in GI stasis, if your rabbit has teeth issues and is going to go under sedation, to fix those, your rabbit needs hay when they wake up right away. So all of these things are really important. That's probably the number one thing. The other thing is proper expectations. So your vet may not know everything about rabbits unless that's what they do on a daily basis. If that is the only species they work with, then they probably know a lot about rabbits, but there are still things that they may not know, and that's okay. Your vet was prepared through a lot of vet school, as I know personally. The number one thing I learned in vet school is not how to spay a dog. The number one thing I learned in vet school is how to learn. And the number two thing is problem solving. And both of these things are very, very important when you're talking about rabbits and bunnies. So have proper expectations. Your vet may not know exactly what's going on, but be patient with them. And if you have an idea of something you heard about, or if you've seen it before, make sure you let them know, hey, maybe look into this and see, does this fit or not? So what should you bring if your rabbit is going to go for a surgery? And this goes for elective, such as spays, neuters, teeth trim, anything that can wait, or it goes for a more emergency surgery. So your rabbit has a liver lobe torsion. Your rabbit's going to go under anesthesia to fix a broken limb, any of these things. Well, the number one thing is bringing diet, just like with a sick rabbit. And this is because as soon as they wake up from anesthesia, we want them to start eating and get their gut moving. Recently, we had a patient come in, had a routine rabbit spay, not a big deal, pretty common, and went home and the next day was still not eating. So getting their gut moving right after surgery is super, super important. So bring their normal diet, bring their favorite foods so that we can, at the clinic, start getting them eating. The other thing to think about is aftercare. So talk to your vet about, what do I need to do for pain management? What do I need to do to make sure they're eating? What happens if in the middle of the night they still haven't been eating and they're going into GI stasis? And making sure you're planning for these things. Now, some of this is on your veterinarian, and it's their responsibility to go over a lot of these things. However, sometimes they forget that this isn't something you necessarily know. So making sure that you're asking the right questions at the right time is super important, and it's something that you guys can definitely do. So I briefly wanted to talk about, why did I make this video? Why is this an important topic to me? Well, the number one reason is that rabbits deserve the same veterinary care that a dog or a cat gets. Some people may disagree with this, and if your rabbit just sits outside in a hutch, that's fine, and I'm not judging that at all. I don't think that's a bad thing. But for rabbits that are in the house and are being interacted with on a constant basis and are litter box trained, they make really good companions, and they can live a long time. I've known rabbits that have lived 10, 12, 14 years. Not all rabbits will live that long, but that's as long as many dogs and cats will live. And they often have a very similar personality difference as dogs and cats. You can definitely tell the difference between Grumpy Crumpy, who right now you guys just see as a sweetheart, and Ollie. They have very, very different personalities and different ways that they interact with us. They have personalities, they live a long time, and make great companions, just like a dog or a cat. So I wanted to at least bring it to people's attention that, hey, there are vets out there that believe this, and you should find one. If you have rabbits, especially if they're a companion similar to a dog or a cat, make sure you're finding a vet that you can work with. Make sure that you're finding a vet that really appreciates rabbits as much as you do. But the other reason that I wanted to make this video is that not all vets are going to be well trained in this. It's not something we learned very much in vet school. I was privileged enough that when I was in vet school, especially fourth year, we had somebody who was board certified in exotic animals. Not every vet school does. And those that don't, it's okay. Your vet still may be willing to learn. And what I was taught by Dr. Zaffarano, who is our exotics vet, is that you need to think outside the box, and it's okay not to know everything. Your vet may not know everything about rabbits, and that's fine as long as they're willing to learn and you're willing to let them learn. Everybody has to start somewhere, and you might just be the person who's able to let your vet be the next really great rabbit vet in your area. Now, that's not to say that you should go to just any small animal vet. Make sure you find somebody who at least has an interest in rabbits, who understands rabbits, because not everybody does. You can't treat a rabbit just like you treat a cat. It's very different. And that's where I think being a mixed animal veterinarian, I have an advantage over a straight small animal veterinarian, because in a lot of ways, rabbits are a lot more like a horse than they are a dog or a cat. And so I know a little bit more maybe about their digestive tract, and I maybe understand a little bit more about how fragile they can be compared to a dog or a cat that can be very tough and have a very different way of digesting their food. So that's all to say, make sure you guys find a vet. If you don't have somebody who works a lot with rabbits in your area, just see if anybody's willing to. They might surprise you. Vets are pretty ingenuitive. We have to problem solve a lot. We don't have the same specialties that people do. And doctors, one doctor may only work on hearts, and one doctor may only work on lungs. And we have to work on every animal and many species of animals. So that's not to say there aren't specialists, because there definitely are. But even a specialist in veterinary medicine is a lot less specialized than a human doctor often is. Thank you guys for watching. If you have questions or comments about your visit to your rabbit's vet, and I would love to hear about it down in the comments of what experiences you have had, good or bad. And also, if you have any questions about what to expect, or if you have questions that I can answer, feel free to leave them down below. And we will see you guys in the next video.